Welcome to Health and Science. Today we are going to talk about heavy menstrual bleeding, or in medical term known as menorrhagia. Heavy menstrual period, or menorrhagia, has been an ever-increasing problem for women worldwide. 10 to 20% of women suffer from menorrhagia. It is estimated that an average woman suffering from menorrhagia can typically lose up to 80 milliliters of blood, amounting to one of the most common complaints among gynecology referrals in women of childbearing age. Menorrhagia can significantly impact the quality of life of any woman, especially women suffering from polycystic ovary syndrome (PCOS), thyroid problems, or obesity. Nevertheless, the prevalence of menorrhagia increases with age. It is estimated that most women suffering from this condition are between the age of 30 to 49. What is considered a heavy period? You may have a heavy period if you change your sanitary towel after every 1 to 2 hours. Use 2 sanitary towels, for example 2 pads, or tampons and a pad. Pass blood clots frequently. Abstain from daily activities or take sick leave because of your period. Waking up at night due to heavy flow. What are the causes of heavy menstrual bleeding? A heavy menstrual bleeding can be normal and may come and go. It could be triggered by stress, change of medication, and emergency contraceptives. But in most cases, it is caused by an underlying condition such as, number 1 is hormonal imbalance. In a normal cycle, the production of progesterone is stimulated by the release of an egg. Anovulation is when you are having your cycle and your ovaries are supposed to be producing an egg each month, but for some reason it doesn't. Therefore, this causes insufficient progesterone and too much estrogen, which then leads to heavy bleeding. Too much estrogen can overstimulate the endometrial lining to become overly thick, which is the cause for heavy menstrual bleeding. Second cause is endometriosis. This is a condition where the tissue around the womb's lining starts to grow in other places outside the womb, such as fallopian tubes and ovaries. Third cause is adenomyosis. Adenomyosis is a condition of the reproductive system where the uterus enlarges and grows thick. This is due to the endometrial tissue growing into the muscular wall of the uterus. Fourth cause is polycystic ovarian syndrome. This is a condition which causes the imbalance of reproductive hormones whereby ovaries excessively produce androgens, a male sex hormone. These hormones are generally present in low levels in women. Fifth cause is fibroids in the uterine. This is a non-cancerous growths that develop in or around the uterus. Sixth cause is pelvic inflammatory disease. This is an infection of the female reproductive system, including the womb, fallopian tubes and ovaries. Seventh cause is cervical cancer. Cervical cancer is abnormal cells in the lining of the cervix that grow in an uncontrolled manner. How will you know if your period is associated with underlying gynecological conditions? You will need to visit your GP and get checked. You might also require a referral to gynecology to get to the bottom of the problem. They may recommend a blood test, a transvaginal ultrasound, or an MRI. For example, adenomyosis pelvic ultrasound can be arranged to reach a diagnosis. The gold standard, however, is an MRI scan. It's by using MRI that you can confirm adenomyosis. What are the treatments for the heavy period? 1. Medication, ibuprofen, non-steroidal anti-inflammatory, to relieve severe pain during the menstrual period. 2. Iron supplement, treats and prevents iron deficiency due to heavy blood loss. Depending on your condition, your gynecologist may recommend one of the following procedures. 3. Dilation and curettage (D&C), a procedure to treat or diagnose uterine conditions by removing tissues from the uterus. 4. Uterine artery embolization. This is a treatment for uterine fibroids. A technique which uses fluoroscopy to block the arteries that feed the growth of fibroids. 5. Endometrial resection, removal of the entire uterine lining and the underlying muscle. Hysterectomy, surgical removal of the uterus. For centuries, women have turned to herbalists for the treatment of menorrhagia. For example, the shepherd purse, also known as Capsella bursipastoris, is a uterine anti-hemorrhagic herb that has been beneficial medicinal since ancient times and can be found in many medieval medical books throughout Europe and Asia. Also, records show that soldiers used shepherd's purse during the First World War to stop bleeding when other drugs were unavailable. Furthermore, traditional midwives over the centuries had documented good outcomes when shepherd's purse was taken internally and reported that it reduces heavy menstrual periods, bleeding due to fibroid tumors, and postpartum hemorrhage. It is considered the #1 herb in treating uterine hemorrhage and one of the most potent uterine astringent herbs that reduce acute heavy or abnormal menstrual bleeding. Other than anti-hemorrhagic properties, this herb is a uterine tonic, which means it works on the muscle tone of the uterus. It acts on uterine muscles by tightening and strengthening uterine tone, thus reducing bleeding. You can use shepherd's purse as a tea infusion or tincture. Food and drinks to avoid. Previous studies conducted by Dietrich et al. Have shown that excess estrogen in the blood is linked to a heavier period in women. High estrogen triggers the endometrium to grow thicker, contributing to menorrhagia. By delving deeper into the relationship between estrogen and a heavy period, it is evident the food and drinks you consume directly impact the menstrual cycle. Food and beverages such as tea, coffee, and soy milk soybean have high estrogen and, therefore, could greatly aggravate heavy periods. So, cutting down the food and caffeine that spurs estrogen levels is crucial, especially during the menstrual cycle. Other food to cut down is chocolate. Chocolate, they are great for your bad moods and cramps, but, do you eating chocolates while menstruating can make your periods heavy? Third food to cut down during your menstrual is dairy products. The majority of the fats which are found in dairy products are saturated and they can cause inflammation. Not only they make your periods worse, but, they can also increase cramps. These are the main food to avoid. Thank you for watching. Subscribe, like and share. For more information visit my website.